Hey everyone, welcome back to another episode of Raising Good Parents. I am very excited today because, as we know, it is Food Allergy Awareness Month, and we are talking about food allergies. And I have a really special guest, Dr. Sakina Bajowala. She is a allergist and immunologist that helps children and families with allergies all the time. She's written a couple books that I'll tell you about at the end, and we're going to talk about food allergy. And I really have just this excitement to discuss this because it is such a common thing that families face, and there's so much misinformation out there. So, Dr. Bajowala, can you just give us a little bit of background about you, and then we'll just jump into food allergy questions?
Yeah, sure. Well, first of all, thanks so much for having me. I'm really excited to talk about this subject because it's very near and dear to my heart. So, I first got involved in allergy and immunology, or became interested in allergy and immunology, when I was a medical student uh, through participation in one of the American Academy of Allergy, Asthma, and Immunology's programs that they had for med students to kind of
Oh, cool.
pique their interest in allergy and immunology. And so they got me, and then I remained interested for many years and
Awesome.
started my fellowship straight out of general pediatrics residency. As I started getting into practice and private practice after my fellowship, I discovered that the patients I gravitated to the most were those with complex food allergy histories.
Okay.
And one of the things that frustrated me is that as allergists, we have so many tools to offer our patients with allergic disease. We have biologics, we have immunotherapy, we have multitude of medications. But when it came to food allergy, all we were taught to do was identify the allergen, instruct the patient and family regarding allergen avoidance, prescribe them an emergency medicine, and say, okay, good luck, see you in a year.
Right. Right. And
Right?
then, like, oh, I think it's still there. Maybe we should check again, and then we could maybe test. And it just always seems quite murky.
Yeah, but there was never anything really proactive. It just felt you were always on the defense and you could never play offense with food allergy.
Hmm.
And I wanted to change that. And so, knowing that in the allergy community, we have for close to a century now had immunomodulatory treatments for allergic rhinitis, we can desensitize to venom, we can even desensitize to medications like antibiotics and chemotherapy. But we
Mm-hmm.
weren't desensitizing to food, which arguably makes such a big difference in quality of life, far more than I would say a venom allergy or a
Right.
penicillin allergy
People are
would for
around
some.
food more than they are venom, hopefully. People are around food more than they hopefully have to take penicillin.
Right. And so when I learned about some of my colleagues in the United States who were exploring the concept of using the framework of immunotherapy and applying it to food allergy, I was really intrigued and wanted to learn from them. And
Okay.
so I would say I started food allergen desensitization in my practice around 10 years ago in 2011 when I
Wow, and
opened
it
my.
seems like it's a much hotter thing now. Like it, so that was
Oh, yeah.
probably very early on in the idea of food allergy desensitization.
Yes. So 10 years ago, there were maybe a handful, dozen or so board certified allergists performing food allergen desensitization across the country. And now we have well over 100. That's still small in
Sure.
comparison to the number of patients who could potentially benefit from the therapy, but it's definitely growing and gaining in acceptance, especially with the FDA approval of Palforzia, which is
Mm-hmm.
the kind of first commercialized and FDA approved peanut immunotherapy.
Right. So let's go back to the beginning of when we're introducing foods, because I'd like to. A lot of parents get the wrong information from their grandparents or parents or sister-in-law or brother or lady at the grocery store about how to introduce foods and specifically how to prevent food allergy. And even, in the last decade, there's been a flop in pediatricians' offices about when you're supposed to introduce peanut, egg, etc. If we want to protect our child and hopefully not ever have to go down the route of needing to desensitize or do any studies, what are the places to start for preventing food allergy? What does that look like for the average patient, parent that is just starting solid foods and really confused about what to do?
Yeah, so you're absolutely right that there has been a shift in the guidance over the last decade about how to safely introduce common food allergens into an infant's diet. Back in the day, even when we were probably back in our pediatric training, it used to be no milk until 1, no eggs until
Right.
2, no nuts until 3, and no shellfish until 4, right? And a lot of us followed that advice. And what we're learning now is that there's actually a growing body of evidence to suggest that maybe that was counterproductive advice
Right.
and that we may actually do a better job preventing IgE mediated food allergies by introducing common allergens into the diet relatively early during infancy. So, generally, as soon as a baby is developmentally able to consume solids, right? You're not going to start doing allergen introduction in a 2-month-old or a 3-month-old.
Right when they come
Early,
out, you give them their hepatitis B, their vitamin K, and then just put some peanut butter on the roof of their mouth or something. Not quite that yet.
we're going to wait. So, you got to hold grandma back. We're not
Right.
going to be doing that. But we want to wait until a baby is developmentally ready to do something aside from breast milk or formula.
Okay.
And then it would be reasonable to start introducing. But we do make some differentiation between babies who are not considered to be at higher risk of developing a food allergy versus babies who might be at an increased risk of developing a food allergy. Because
Okay.
what we know is that for those high risk infants, we may actually want to get some of the top food allergens in by 6 months of age.
Okay.
Whereas for other babies who are not at high risk, we just say there's no delay in the introduction of food allergens. So as soon as your baby is ready to start doing salads, whenever you feel like that should be, feel free to introduce the allergens, right? So there's just
Gotcha.
a little bit of difference there. And so the question is, how do we define who is high risk,
Right.
right? And that has changed also. It used to be that we thought that having a sibling with a peanut allergy put you at considerably higher risk of having peanut allergy yourself as an infant. And what we know now is that most of those babies can actually be introduced to peanut in the home setting without any special screening.
Great.
However, for babies with severe eczema, so not
Okay.
mild, little bit rashy, but severe, either generalized or oozing, weeping, super infected type eczema, or babies who already have a pre existing food allergy, such as egg, for example, we know that these babies are considered high risk for the development of peanut allergy.
Okay.
And so these are the babies who we should be targeting for earlier allergen introduction, somewhere
Okay.
between 4 to 6 months of age. It used to be that we would bring these babies in to test them first and then use the test results to stratify them into avoidance, challenge, or home based introduction. But the new consensus guidelines suggest that that sort of screening testing may actually be overcalling clinical
Mm.
allergy in babies
Okay.
and just uncovering sensitization, where your body makes allergic antibody against a food, but you may not actually be allergic. And so we don't
Okay.
want to falsely diagnose babies with allergy. So now what we're doing is when we identify these high risk infants, we give the family an opportunity to bring the infant into the office for supervised feeding, or what we call an oral challenge in the allergist's office, so that if it's well tolerated, fabulous. go home. We'll have you continue feeding your baby at least twice a week. And if there are any symptoms that develop, they'll be in a medically supervised setting where we can handle it and it causes less anxiety for the family.
Wow, that's so interesting to hear. So what you're saying is, if they're the average normal bear, then around 6 months of age, when you're introducing all the other foods, you can introduce those more allergenic predisposing
Yeah,
foods. If they are at higher risk, meaning mostly that they have severe eczema, then you have them come into your office or the allergist's office, and rather than doing tests preemptively, you will do a exposure challenge to see how they do, and then if they do fine with that, continue to introduce it on a regular basis so that they remain tolerant to that allergen that otherwise they could develop a food allergy to.
that's absolutely correct.
Okay. That sounds like such a more useful way about it, because oftentimes what I've seen in the past and what I've seen some of the previous consensus statements saying is do that and then get them to allergists. And by the time you do that at 6 months of age, you do the blood work or you decide to refer them to the allergist, then it's 7, 8 months before they actually get in. And you're just, it seems like that window where you have the potential to make a difference keeps closing and closing and
Yep.
closing.
Gets
And
shorter.
yes, so early identification of those at severe or higher likelihood because of severe eczema are brought into the office for exposure. Are there any other conditions where they're high risk? You said if they have other food allergies already or severe
Yeah.
eczema. Is there anything else that we're missing?
Not really. Those are the
Okay,
two main
right.
risk factors for the development of peanut allergy in specific. Now, we use that to extrapolate to other allergens as well.
Sure.
So most of the data we have is about peanut specifically. And that's if you have ever heard about the LEAP study or learning early about peanut and the LEAP on study, those were designed to specifically investigate the utility of early introduction of peanut in high risk infants. And it discovered that introducing peanut early really did seem to prevent peanut allergy.
Right.
The Leap On study allowed us to understand that if these infants with early introduction maintained peanut in their diet for a period of years, they seem to have prolonged protection
Wow.
against the development of peanut allergy later on in life. So, what that taught us is that it's not just early introduction that is protective, but sustained exposure over time. So many times parents are so nervous about introducing peanut, right? Like we've created this whole like cult of fear around this
Right.
one particular food. And they say, okay, I don't want my baby to have a peanut allergy. I'm going to introduce it. It goes fine. And they, phew, okay, I'm never doing that again. And then 2 months later, the
Oh,
baby
wow.
gets exposed to peanut and they have a reaction. The parents come to me and they said, but I did it right. I introduced it early. What happened? Right. So we really need to emphasize the importance of sustained exposure.
Okay.
And we think that is easy and non anxiety provoking and financially accessible for families as possible so that they can maintain this over time.
Now, a really interesting phrase that you used there was financially accessible. And I
Mm-hmm.
will tell you that when sometimes I'm on social media once in a while, and I will see all of these ads for different kits that make it easy to introduce allergens. And when I look at them, well, it's nice, you're not going to miss anything, but they're like $50, $100 a month. And to me, that seems really expensive for things that are otherwise off the shelf. Is there a reason to turn to those, specialty powders and things that you mix in versus Skippy, Jif, Peter Pan, whatever, peanut butter
Yeah,
have you?
my personal preference is that food allergen introduction should be done with whole foods.
Oh,
Uh,
I'm so glad that you said that. I didn't know what you were going to say, and I was like, "Oh, what if she disagrees with me?" No, but okay, thank you. Keep going.
yeah,
Sorry.
so, we go to the grocery store, we buy food. Maybe we're not going to add sugar and salt to baby's food,
Sure.
but we can take a natural peanut butter. and thin it out with water so it's not a
Right.
choking hazard, and mix it into a little bit of formula or breast milk or baby cereal and introduce it that way. Or applesauce. I love mixing peanut into applesauce. I think that works really well. We can scramble an egg and introduce that into the diet. There's lots of ways to do this without going into the poorhouse. Now,
Yes,
for
thank you so much. Because I feel like a lot of parents feel like if we don't do this, and I mean the marketing certainly makes you feel that way. If you don't do it this way, you're going to miss something, and then they're going to have a peanut allergy or a shellfish allergy. They're going to sit at the peanut-free lunch table. They're going to get mocked because they have to carry an EpiPen and all. I mean, it can really make parents feel like
right,
less than ideal that they're doing something detrimental to their child if you don't invest in this $50 per month powder that you're going to mix in, and then you'll forget for a few months and they'll be eating a peanut butter and jelly sandwich and you'll be like, oh yeah, we have all this leftover powder that we never used, and it was like $300 worth of allergen exposures while they're munching on their peanut butter and jelly.
right. So it's not so much that these powders are harmful in any way. And I certainly think they can do the job and get the job
Sure.
done. And for some
Sure.
families, the convenience might be worth it. But for other families, it's more important for it to be accessible so that they can maintain it. Because what if they invest money into doing this and then they can't keep it going and now they feel
Right.
overwhelmed? So they just stop.
Right.
Um, so it's certainly not opposed if a family comes to me and they tell me that this is what I want to do. I'll say, okay, fine. Have you tried doing it with regular food? And they say, yeah, we've tried. We just couldn't keep up with it. Okay, fine. Do this. No
Sure.
problem. But if it doesn't work out for you, don't stop feeding the allergen. Come back to me and I'll walk you through how to get the other ones in.
Awesome.
Um,
That's such a helpful approach. Now, if I'm having lots of different questions that pop to mind that are
sure.
often asked in my office. Mom or dad allergic to peanut, egg, any specific food item? Do we need to do anything special with those children, or can they be exposed at the regular interval as if they are the average bear that doesn't have a family member with a allergy?
Yes. So, what we are saying now is that babies with a family history, even a close family history of food allergy, do not to be need to be screened prior to allergen exposure. So, no testing is required. If the family is nervous and they would rather do the allergen introduction under medical supervision, I don't know a single pediatric allergist who's going to say no.
Sure,
We would
of course.
much rather bring that baby in and get the food in versus just not get it in at all.
Right, because if
Um,
they're so nervous, then they might just say, "Well, I'm not going to do it," or "I have to leave the
right.
house when it gets done because I'm so allergic that I can't be around it." Well, if
Yeah.
if if we can either figure out how to do that in the home setting or do it in a place where you feel comfortable so that it can get done, because it's more important that it gets done than not. So we'll make it easy and accessible to be able to do that.
Right. And so often many of us pediatric allergists have created designated time slots on our schedule, either once a month or once every few weeks, to do like a baby feeding clinic or a peanut clinic, where we bring a bunch of infants in and we just feed them. And it
They
works
all sit in
great.
one big room, and you just kind of pop a
Well,
spoon in each one of their mouths.
pre-COVID, pre-COVID, they used to all sit in one big procedure room.
Right, right, right.
Post-COVID, they all have their own room.
Well, now with post during COVID, you could just have them all in the parking lot, like a row of minivans, and you just go from car to car, giving them their little amount of peanut, and you just
Maybe
kind of go down the row.
depending on the season. And
Yes,
certainly for these babies, we want to have our eyes on them too, right?
of
We're
course.
monitoring when we're doing an infant feeding clinic. We are actually checking on these babies every 15 minutes, making
Sure.
sure there's no signs of rash or rhinorrhea or any GI symptoms, anything at all. So we can get our finger on the pulse of that and catch symptoms early so that we don't keep feeding through a reaction. And
Right.
that's something that gives parents a lot of reassurance too, because sometimes they're just worried that a reaction will be starting and they're somehow going to miss it
Sure.
because they don't know, and then they'll end up feeding through it and cause a horrible reaction. And so part of what we need to do is education, right, for these families in advance. And this is where our local pediatricians can be so incredibly helpful because you guys are the first point of contact with these families. And you already have the rapport and the trust. And
Right.
so starting that education in the pediatrician's office about how do we introduce allergens? Here are the CDC or NIH guidelines with the PDF on how to prepare the food and how to introduce it, like a recipe. So it's like a no-brainer.
Right.
And these are
Here's
the
exactly
things
what you do.
to look for. This is how often you should keep it into the diet afterwards. And if anything goes wrong, give me a call. We'll get you hooked up with your allergist. Right. Instead
Awesome.
of necessarily saying, oh, there's a peanut allergy in your family, you better go see an allergist right away.
Right, and then it takes 3 months to get in, and that window, like we said, then kind of closes, and or it just gets a little more iffy. Now, another question that I hear frequently is if we have a baby that's diagnosed having a true, peanut allergy or a true egg allergy, and mom is still breastfeeding, does mom need to eliminate those things from her diet, or is there a benefit to her continuing to eat peanut butter and egg or whatever it might be that the child is allergic to, obviously in a setting where they're not going to cross contaminate to their baby?
Right. For the most part, if a baby prior to developing an allergic reaction to a directly ingested food was tolerating that food through mom, we do not remove it from mom's diet.
Okay.
Um, there are rare exceptions in that, in some cases, a baby is having active GI symptoms, and they're just not resolving until we attempt a temporary elimination diet for mom, or that it's not just that we're dealing with mild to moderate eczema that we're able to get under control with skincare and in sporadic use of topical steroids, but this baby has really severe eczema, oozing eczema, super infection. And we really feel that for the child's welfare, we have to do a trial of allergen elimination from mom's diet, then we would pursue
Right.
it. But we don't want to overdo the elimination of the allergen, because if there's a certain amount of allergen exposure that you're tolerating without having a reaction, perhaps that is helpful. We
Sure.
don't have a lot of data on that yet to say one way or another is having exposure to a food allergen through breast milk somehow protective. And so what we can say is that, well, we don't know, but it's not hurting. So if you want to continue breastfeeding and it is easier for you to not pursue an elimination diet, certainly that's what we would recommend. There
Awesome.
is some data to suggest that when mild to moderate eczema is the only clinical manifestation of a food allergy in a child, taking that food completely out of the diet can potentially do more harm than good,
Hmm.
because they can lose whatever tolerance they have already built up with the sustained exposure, but they can stay sensitized, which means that in the future, if they get exposed again without the benefit of the tolerance that they had from the low dose exposure before, they might actually have a more severe acute reaction.
So it makes, I think, hearing that makes me think that it would be wise to avoid food allergy testing in those that aren't, qualifying for severe eczema or a suspicious history, because they might have mild eczema, and well, we'll just do some food allergy, IgE testing, uncover that, eliminate it from the diet because the lab said that you have a food allergy to this, and then we lose that level of tolerance that we have, and then could go on then to have more severe reaction in the future. Is that what I'm hearing?
That is exactly right. And that is why um, allergists in general strongly discourage kind of food panel testing on
Yes.
blood work, because it can be very confusing for families. They have trouble understanding. They look at this and they say positive, 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 and they feel like they're doing wrong by their child if they don't take all these
Right.
things out. And even if they're given guidance, otherwise, even if they're given guidance from their pediatrician to say, I think you should leave these foods in, sometimes they just take it out anyway.
Well, because it's hard when you have this like data to ignore that. So it's better not to have the data if we don't need it, because it's like, well, it said he was allergic to peanut, but he was eating peanut butter, Reese's peanut butter cups while he was having his blood drawn. I mean, that doesn't compute. So why test for things that we know are not going to change what we do for the child anyway? So, I mean, that's kind of a soapbox that I get onto, is like the shotgun approach to lab testing often causes more visits, costs parents more, results in worse medical outcomes if we're then eliminating things that we don't need and then having the issues that you described. So, it sounds like we're on the same page in terms of avoiding unnecessary allergy testing and investigation.
And that goes for skin testing too, not just for
Sure,
labs. So,
sure.
we don't want to bring a baby in and just do the entire food panel. For what? If something's already in your diet and you seem to be fine, what do I care if it tests positive?
Right.
It's not going to change the management. And so, kind of, all physicians, we do this, but I'm only going to do a test if the result is going to change what I do next. And if it's not going to change what I do next, I'm not going to do the test.
Right. Oh, love it. That's such a good approach. Now, you have a strong interest, as we talked about at the beginning, in oral immunotherapy. And the really cool thing is that not only do you do that, and you've been doing that for longer than most allergists in practice, but you also wrote a book for kids that are going through oral immunotherapy, because it's kind of an interesting thing. I've had some patients that have gone through it, and I know it's not the most comfortable thing, and there's always a lot of anxiety built up around it, because you're saying, yes, you're allergic, but we're going to expose you to this, and you might have some symptoms, and we're going to work through that. But can you talk about like the book a little bit, Zippy, a story about oral immunotherapy for food allergies? Because I think that is a really neat thing that you don't hear a lot of people that have both practiced and also written a children's book that helps with their practice.
Oh, yeah, I'd love to. So, a little background about what oral immunotherapy for food allergies is. It's a way of retraining your immune system to tolerate something that you're currently overreacting to by
Okay.
introducing back into your body in tiny, tiny amounts. And then once we've established that you're tolerating that dose, then we slowly, over a period of months, increase the dose and maintain it, and then increase the dose and maintain it, and increase the dose further until we get from a microscopic quantity of that food to a whole serving of that food, which the child can then eat on a regular basis.
That's
It
so
can
cool.
be
It's like, people that are afraid of heights. You stand on top of, a textbook, and then you move on to a chair, and then you move on to standing on a tabletop, and eventually you get to the place where you can jump out of an airplane or something. Like, I mean, I don't know
right.
if that's how it actually works, but in my mind that's how it works.
Yeah, to a certain extent, except that we're not just retraining the mind, we're actually retraining the immune system.
Right.
Uh, And so it's understandably anxiety provoking for both families and children to spend
Sure.
a number of years saying, don't eat this food. It could make you really sick. It could kill you. It could send you to the hospital. And then go to the allergist office and they say, what about we feed you this food? And we do it
Right.
not only, but let's do it every day. And every time we see you, let's increase the amount.
Yeah.
And so they, half the time the kids look at me like I've completely lost my marbles. And so I thought it would make sense to write a children's book to explain the process of food allergen desensitization or immunotherapy to children in a way that was non-threatening and very relatable. So, what we decided to do was use the metaphor of a race car who is allergic to gasoline. And
Okay.
so, similar to how children are allergic to their fuel, which is food,
Right.
the Zippy is allergic to gasoline, but he has this dream of being a race car. And unless he can tolerate racing fuel, he's not going to be able to do what he wants to do. And so he meets with his crew chief, who manages the pit crew, and the crew chief slowly, slowly desensitizes him to gasoline or racing fuel, one drop at a time. And it goes through how Zippy actually needs to take care of himself before he starts this process to be as healthy as possible. So he gets an oil
Wow.
He gets a new paint job and a wax. He gets his filters changed out, all that stuff. And it talks about the support system. So, one of the things we integrated into the book was a discussion guide for parents and caregivers. So, as you go through the book, you will have QR codes on the pages that you can scan. It'll take you directly into a discussion guide to help to
Cool.
prompt discussions about, well, Zippy's doing this and he has his sister and his crew chief. Who's in your pit crew? Who's your support? Or Zippy had to do all these things to get healthy. What do we need to do to get you healthy? Things like that. So
That's so
hopefully
cool.
children reading this book, they can go into oral immunotherapy feeling more comfortable with the process and more empowered.
Well, I think that's probably such a useful thing for families too, as a way to talk about it and frame it a way that children can understand. Because saying that you're going to go and have peanut, well, we've been trained for so many years to avoid it at all costs and check food labels and tell grandma and remind friends and family we can't have peanut, that to go and say, okay, we're going to do the opposite of that now would be a scary concept to try to explain to a child. But using this, and oh, that's so cool. I really like that. So,
Thanks.
well, gosh, it has been such a pleasure to talk with you. And I think it's been really eye opening for myself and hopefully for listeners too, to understand more about food allergy and what's changed and what we should do in our day to day lives as both pediatricians and parents, so that we can protect our children from food allergy and deal with the food allergy when we face that. So I will make sure and put links to all of the things. So you have, I know you have two books. You have the Food Allergy Fix, which is an integrative and evidence-based approach to food allergen desensitization, which is the book for parents and for adults with food allergies. And then you have Zippy, a story about oral immunotherapy for food allergies for children. And then you also have your Instagram, which is allergist.mommy, and your Facebook page, same. And then your allergist.mommy or allergistmommy.com blog, all places where people can find you, learn more, feel more comfortable with food allergy, and hopefully get to enjoy food more as we work through these food allergies and move out of food allergies. So it has been a real pleasure to talk with you, and thank you so much for your time.
Oh, thanks so much for having me. I really enjoyed the conversation.
Thanks for watching. Before you go, will you hit the thumbs up like button, because that will make me feel great and it will make you feel great too. Hit subscribe so that you don't miss another episode. And if you have a question that you would like me to answer, just text me. It's 402-256-0768 and I will answer your questions live in an upcoming video. Keep up the good work.